Sanderson. She told me how she fractured her tibia, so she came to the hospital here. Her one allergy is that she has sulfa. We'll have to keep an eye on that. And she has 4 different medications here in our monitor that have been prescribed by the provider. Her weight is 152 pounds.
Hi, my name is Raylan Renicky. I will be demonstrating how to do an IV bolus as well as IV piggyback. Okay, so to begin the skill, before I head into the client's room, I'm going to look at the electronic health record. I'm going to verify the orders that I'll be performing, and I'm going to start with an IV push. So I'm going to gather the medications. Before I do that, I'm going to just look at the chart. I have Llewellyn Sanderson, date of birth, allergies to sulfa. She is in the orthopedic unit due to fracturing her left tibia. Her vital signs right now are quite elevated. Heart rate 95, blood pressure 134/82, respiration is 19, oxygen on room air is 98. She's alert and oriented. She currently has an IV in. I'm currently with D5.45% infusing at 100 ml per hour. Okay, so now that I've evaluated her chart, I am going to gather my supplies. So pulling out, it looks like we need to do a little pain assessment due to her vital signs being high. So I'm going to go into the room and assess her pain first. Hi, my name is Raylan, and hygiene, provide privacy. I'll be your student nurse today. Looking at the electronic health record, would you give me your name and date of birth, please?
Luella Anderson, 117XX.
That's nice. Do you have any known allergies?
Yes, I have sulfur.
Okay. I see that here. I have that on the chart as well. How is your pain?
It's really sharp and stabby.
Okay, where is your pain located?
My left tibia.
In your left tibia. Okay, that makes sense. So it's short and stabby. On a scale of 1 to 10, 1 being less pain, 10 being extreme pain, how would you rate your pain?
It's a 9 out of 10.
9 out of 10. Okay, what makes the pain worse?
Especially if I get up to work.
Okay, does anything make the pain better?
Yeah, putting some ice would make it better.
Okay, next we'll get you some ice and perhaps a pain medication. Would you like some morphine? You have morphine that could be available right now via IV. Does that sound interesting?
Yeah.
Okay. If you don't mind, I'm going to assess your IV site. Okay, looking at your IV site, I'm not noticing any inflammation or phlebitis. I'm not noticing any bruising or infiltration. Are you having any pain or discomfort at your IV site?
Not really.
Any burning or coolness going on?
No.
Okay, nice. So, now that you appear to be comfortable besides your pain, I'm going to head out of the room, grab the morphine, and I will be right back, okay?
Okay.
Okay, client is in, their bed is in a low position, they have their call light, they appear to be comfortable, side rails are up, hand hygiene, open the curtain. I've left the client's room. I'm going to look at the charts. I know that they have the morphine available, so we are going to gather the morphine.
To get rid of that pain, we do have.
Okay, so looking at the electronic health record, their pain is elevated, 9 out of 10. So we're going to go ahead and give the morphine.
All good right now. Does that sound okay? All right, so good.
Okay, so morphine. We're going to look at the client's name. Llewellyn Sanderson, Llewellyn Sanderson. Allergies to sulfa. This is not got sulfa in it. We're good to go. On the medication is morphine. Morphine. We're going to 2 milligrams. 2 milligrams per 1 milliliter. Perfect. Make sure that says 1 milliliter. It does. Okay. The route, we're going to do IV. The time can be given PRN every 4 hours. She is able to have this. The reason is for 9 out of 10 pain. So I'm also going to look at this, make sure the medication coloring is okay, the packaging is intact, and it's not expired. Okay, we're good. So I did my first check, so I'm going to do my second check. Llewellyn Sanderson. Llewellyn Sanderson. Medication is morphine. Morphine, the dose, 2 milligrams per 1 milliliter. Yes. The time maybe now. The route IV push. We're doing an IV push. Okay, that works. The reason for pain. Okay, so I've done my 2 checks. I'm going to grab my supplies. We're going to do 2 salines for the push. Looking for the expiration date, for the coloring, intactness. It seems to be okay. So, and I've got my supplies to do that. So I'm going to head into the client's room. Hi, it's Raylan. I'm your student nurse. I've returned with the morphine. Ken, before we begin, would you give me your name and date of birth, please?
Luella Anderson, 117XX,
Nice, and your allergies again?
sulfur.
Very good. Have you ever had morphine before?
Yeah,
You have? Okay, so it's a pain medication, so the goal is to reduce your pain, and the onset should be rather quick. Some of the side effects with this can be decreased respirations, maybe some drowsiness, so we wouldn't want you to walk without a nurse, so we want you to call before you try to go to the bathroom or anything. Does that sound okay?
okay.
Okay, very nice. I'm gonna do my hand hygiene, provide privacy. I forgot to do that at first, but we did it again. Provide privacy, doing hand hygiene. Okay, nice. So I'm gonna do my third and final check with morphine. Make sure the name matches Llewellyn Sanderson. Medication is morphine, 2 milligram per milliliter. The reason is for pain. The route IV push. Yep. The time is now. Okay, so we've got that. We've done our 3 checks.
Yeah, I'm
I'm going to.
how is it going, Luann? How's the, is the pain still there?
I'm still in pain.
Oh, okay. We got the morphine here.
Okay, I'm going to expose your IV site. Okay, just checking it out again. Looks good. Having any pain
does that
there?
still sound okay?
Any
Your
discomfort with your
pain
IV
still pretty
site?
Yes.
No.
Okay.
bad? And, do you have any allergies by any
So
chance?
we're gonna do our 3 syringes here.
Okay, thank you.
Done our 3
Yeah, she's got
checks.
this morphine here, which she's got no problems. It's
1
like,
milliliter. Okay, looks good.
Have you heard morphine before?
Alright. We
Okay,
need
yeah, so this
3
is gonna be
alcohol
the,
prep pads.
basically just an analgesic with a pain reducer. And try to get that really bad.
I'm going to
try
open
get
them
rid of that back
beforehand
pain,
so it's a little bit easier.
out of 10,
Okay.
which will be appropriate
So,
for this.
now
for this
within that,
medication.
I'm going to pause the machine.
Um,
So this is
hopefully
paused for
we
now.
But there are some side effects along with it.
Okay.
Some
And the
times
first
things like
alcohol
this
prep
can
pad,
cause,
I'm
some sort of
going to
constipation and
pinch
GI
this,
sort of depressive effects.
and
That
then
slows paralysis
I'm
down.
going to pinch it.
But also the biggest one we want to
There's
take a
no
look at is
backflow.
respiratory depression. That can be super scary.
Okay, and I'm going to wipe this for
But,
15
your
seconds
respiration
around
rate
and on
should be
top.
kind of
Did it for
in a good
15
spot.
seconds, let it
That was
completely
maximum
dry.
in my check, so
And we're going to do our first saline flush to make sure that the tube is patent,
do you have any questions
not
about morphine?
contaminating it, keeping it sterile, locked on.
So
Okay,
we'll
we're going to
grab
do
some
5 to
gloves.
10 mils.
Very good. Privacy.
There we go. Okay, gonna do my second alcohol prep pad. Line is patented. Is that feeling okay? Any concerns at this time?
No.
Okay, good. Okay, doing our second one for 15 seconds,
I'll ask you your
all
name.
around.
What's
Make
your
sure
name?
it's real dry.
Your name, date of birth.
Okay, now we're gonna do the morphine. I'm gonna remove the lid. Making sure everything stays sterile.
I'll check your
Okay,
wrist
so if you
bands.
have any discomfort or burning or tingling or anything at all, let me know. We can stop, okay?
Okay.
The onset with this medication will be
Super,
rather
super
quick.
important. Take a look at this
I will
IV.
want to keep an eye on you the entire time, so do report if you feel anything out of the ordinary. We're going to pump this very slowly. And I also checked to make sure that these medications were compatible, and they are, with the dextrose. So we're going to push this very slowly over the course of about 1 minute. Okay, a minute has gone by. Look at that. Are you feeling all right?
Yeah.
Okay, nice. I'm just gonna set that there. I'm gonna do my final alcohol pad. Okay, gonna clean this off. 15 seconds.
This was. Alright. We'll use.
Let it dry completely. And I'm going to insert 5 to 10 mils of saline. And I'm gonna do it the same rate as I did the previous bed, which is over about 1 minute. Okay, so we're gonna do this for about 1 minute, 10 milliliters.
Just gonna swab
Nice,
this for
there it
about
goes.
15 seconds.
Okay. Nice, and I'm going to let this go. Okay, line looks good. There are not any kinks. Okay, I'm going to resume the pump here. How's your IV site? Any burning or irritation?
No.
No? Okay. So I'm going to cover you back up, collect my supplies. I will stay with the client for a few minutes to ensure that they are not having an allergic reaction or any sort of reaction at the IV
Also,
site.
I wanna make sure there's no bubbles in here.
Okay, throw my things away, gonna do hand hygiene. Okay, how are you feeling at the moment?
I feel better
You
now.
feeling better? Nice. Morphine should work quickly. I will be back in about 10 to 15 minutes to assess you to see how your pain is, okay?
Okay.
Do you have any questions or concerns at the very moment?
No.
We also
Okay,
wanna make sure
so
we
the bed is in the low setting, they have their call light, hand railings are up. I'm gonna take this out of the room
we
with
think
me.
it's nobody's coming in. This
Okay,
is our
open
return
the
over here.
curtain.
Something's coming in, we
Okay,
pause
set
and
these
normal
things to the
setting,
side.
0.45.
Okay, so that's the end of my IV push.
Use 10 minutes.
And I would be going back in
This
about
one isn't
5,
very specific on how much
10,
time.
15 minutes to check on their pain and their level of consciousness and safety and whatnot. So on to the next skill, I will be doing an IV piggyback.
It's always better, but
So the time, they need 10 milliequivalents of potassium chloride now because Llewellyn Sanderson has a lab value of 3.3 for her potassium, which is low. So we're going to supplement by giving more potassium. So getting my medications. I'm going to look at the chart here. Okay, so I'm going to do my first med check. Llewellyn Sanderson. The medication is potassium chloride. Potassium chloride, we want 10 milliequivalents and 100 mils of normal saline. Okay, looks good. We're doing IV piggyback to infuse over 1 hour. The reason, because she has low potassium, so this order makes sense. Okay, I'm going to look at the medication bag for expiration. Looks good. Intactness, color of the fluid, looks good. Okay, so I'm going to do my second check. Llewellyn Sanderson, medication, potassium chloride, 10 milliequivalents and 100 mils. Okay, nice. How we're doing it, IV piggyback over 1 hour. Okay, and the time is now, and the reason because she has low potassium, so this makes sense. So gather my supplies, make sure I've got my little things here. Okay, we're gonna head into the client's room. Hello, I'm your student nurse, providing privacy. I'm gonna set my supplies down and do hand hygiene. Okay, before we begin, would you give me your name and date of birth?
Luella Anderson, 117XX,
And your known allergies?
sulfur.
And how is your pain from the morphine?
It has gone down now.
Nice. How are you feeling? Confused or any dizziness?
No.
Okay, nice. If you need to go to the bathroom, please call us. We will assist you to the bathroom. Okay. Before we do that, well, we'll do our third check. So, you gave me your name, Llewellyn Anderson. Okay, compare that to the medication. Llewellyn Anderson, the medicine, potassium chloride. Potassium chloride, 10 milliequivalents and 100 mils. The route IV piggyback. Okay, the time right now, we're gonna do this for 1 hour, okay?
Okay.
Okay. And the reason, because your potassium values are low, so we want to bring them up, so we're going to supplement with this fluid. Does that sound okay?
Okay.
Alright, nice. So potassium chloride, like I said, is an electrolyte supplement that's going to bring your lab value for potassium up. Some side effects of administering fluid could be fluid overload. So we'll be watching you for fluid overload, which we could listen to your lungs. We would assess for edema, perhaps your mucous membranes. Otherwise, this is going to help bring your potassium levels up. Sound good?
Yeah.
Okay, nice. We'll also be watching for dysrhythmias. So after every 3 checks, I'm going to assess your IV site. Is your IV site still okay?
Yeah.
Okay, I'm looking for phlebitis, infiltration, any hematomas. Okay, so I am going to let that continue to run.
I have my
I'm going
potassium
to-
chloride. This IV is a little bit different. This is the piggyback, not the flush.
Clean this
And I'll
for
bring this
15
one.
seconds.
We'll do our patient checks, or medication checks here.
Okay, let that completely
So
dry.
the patient is Llewellyn Sanderson.
I am going to
The medication is potassium chloride.
open my bag.
The dose is 10 milliliters equivalent. The route is IV piggyback. And the time is now. So roughly 1:30 minutes now. So we'll head over there with our stuff.
This looks to be
As we
sterile.
come in,
That's fine anyway.
we'll do
Okay, this seems to be sterile, so we're good to go.
grab some gloves. We're also trying to make sure, since the patient is a high fall risk,
Make sure there's no kinking in the
trying to make
tubes.
sure that
Packaging was not
I shouldn't have
expired.
left it this high, the patient's high
looks
in the
good.
room. I should have made sure the bed
Okay,
is locked.
so
Safety
I'm
belts are
going
on,
to
and the
spike
patient
my
is
bag
lowered
here.
and the lower to the ground. Because, you know, she's high risk.
That.
Doesn't coming in. After I administer the morphine, I would probably wait
Make
like
sure this is
maybe
completely
less
closed.
than 2 hours, but I'd say maybe more like 30 minutes to, well, probably more like an hour.
Looks good.
It would take
I'm gonna hang
for
this up
morphine
higher
to
than my
administer
primary.
fully.
Okay.
And I would probably check on them and ask about.
And just because I kind of did that a little soon, I'm gonna clean
But
this
here, I'll do
once
that.
more.
How's it going, Lamb?
I'm doing much better now, actually.
Sounds good.
Okay.
How would you rate your pain?
15
I'd
seconds.
say it's a 2
Make
out
sure
of
it's
10.
completely
cool.
dry.
And it's still not like radiating anywhere or
Okay,
anything like
keeping
that?
this
Not as
sterile.
much.
Okay, sounds good. Cool. So the morphine's doing a good job.
Connecting this.
Maybe about
Locking it
their
in.
set of vital signs to make sure there's
Okay.
no
And now I'm going to do my back
depressive
priming.
effects, or any sort of adverse effects. If all is going
Okay,
well,
I'm
I'd probably
going to
start the
open this.
administration of the potassium chloride here.
Oh.
But first I'd ask the patient, Lynn, do you know anything about potassium chloride by chance?
No, I don't.
Okay, sounds good.
So this bag is
Will the doctor
empty,
order
but
that some potassium
you
chloride
can
for
see the
us
fluid is
today?
coming. It
Because
is
we noticed in
filling.
the labs,
And it feels
you
about
just had
halfway.
a little bit less potassium in your
Looks
blood
good.
than you should.
I'm gonna raise this up.
And the potassium
Leave it a little squeeze to make sure it's draining.
kind of
Looks
make sure
good.
our smooth muscles work well, so like our
And
stomach,
right there.
all of our digestive organs, our
Okay,
heart.
those are connected. Make sure the lines look good. I would set
And
this to the drip
specifically,
rate.
sometimes people have like heart arrhythmias and
There's medication, and these medications I did check beforehand, they are compatible. How are you feeling? How's the IV site?
It's good.
Any irritation, burning, discomfort at all?
No.
Okay, very good.
Feeling better
Is that
now.
hurting at all?
Nice. I'm not seeing any infiltration or signs of phlebitis at this time. So I'm going to gather my supplies.
As far as administration goes.
Throw it in the garbage.
I'm gonna have to call you again.
I'm going to stay with the client for about,
We'll also
for a few
do
minutes, just to make sure
patient check here.
everything is working
We're
okay.
gonna do the second patient check.
Going to do my hand hygiene. Nice.
I would in theory go back here. in
Do
my
you have any
room, and do the
questions,
second
comments, or
patient check again.
concerns at this time, Llewellyn?
Which would be the same sort of
No.
idea.
Okay.
Our patient is doing
So,
Sanderson.
We'll be back to
Um,
monitor you if you need to use the
the
bathroom.
patient
Please
is
use your
the-
call light. We'll help you to the bathroom.
Potassium chloride. The dose
Bed is in the lowest
100
setting.
millimeters,
Side rails are up.
with the
They have their call light. We'll
potassium
get them
chloride
privacy.
over 1 hour.
Okay, so I'll be back in about 10 minutes to check on you, okay?
So that's gonna be-
Okay.
Okay, nice. Heading out of the room. Going to open the
Drop these up,
curtain.
probably get the
Going to
doc-
discard my supplies here. Hand hygiene. Going to document the things.
My third
We'll see
medication
about
check
10
is
minutes has
pretty
gone
much
by. I'm going to return.
Um,
Hi, it's Ray Landis,
so kind of just
nurse.
comparing them all
Would
again.
you give me your name and date of birth?
for the
Luella Anderson,
potassium
117XX.
chloride,
Nice.
Lewis
Okay,
Anderson
so
is the
how
patient.
are you
Potassium
feeling?
chloride is
I'm
150.
feeling better
The
actually.
dose
How's your IV
is
set? Are you
10
noticing any coolness or
millimeters of
tenderness in your arm at all?
No.
and,
Okay, nice.
the time is now.
Well,
So,
I would do an assessment. I would
Any
assess
answer to that?
for any edema. I would listen to lung sounds.
With this
I would
administration,
listen
it's
to your
just
blood
very, very
pressure
important.
and pulse to
so
make sure
putting
there's
these
no
parts very
dysrhythmias.
sterile.
Make sure your breathing pattern's okay with the morphine. Okay, so if you have no questions, I'm going to head out.
No question.
Bed's in the lowest setting, handrails, call light, privacy, the curtain is open. Left the room, going to document the things, and that completes the skill.